Good evening, everybody. I'm extremely honored to be here on the chair, being one of the eminent interventional cardiologists of the country, Dr. Ashok Seth and Dr. Subramaniam. I'm presenting this late stent thrombosis where the PCI failed, but how do we achieve the successful reperfusion? This is the initial time when the patient presented as 57-year-old diabetic male with STEMI inferior wall with a complete heart block, a heart rate of around 50, and a systolic blood pressure of around 98 millimeters of mercury. It's a left dominant circumflex through a transradial approach. There was a TIMI3 flow even though there was a complete heart block, and the patient continued to have ST elevation with continued pain. So I thought it's a very discrete proximal circumflex before the large major OM, and a direct stenting could be attempted. And this was the 5 French guide catheter, and the direct stenting was attempted, and you could see that the stent could not cross the guide wire as well as the guide catheter gets prolapsed into the aorta. And I couldn't see any significant dissection or anything, but there is a calcium there which you could see on the fluoroscopy. And this led to the procedure, led to the closure of the major side branch. You could see the major OM also is closed. And And then I could do a thrombus suction with a 6F EBO guide catheter. The guide catheter was changed, and the 3 millimeter balloon was delivered and then dilated after the thrombus section. The stent the delivery was again difficult. You could see there was a prolapse of the EBO guide catheter. And finally, with a constant forward pressure, there was a movement of the stent into the proximal circumflex. This was a 3.5 into 23 mm biomime, and deployed finally, and I could achieve a TIMI3 flow with a good no residual stenosis in the dominant circumflex, but you could see that the major side branch was occluded. As this is the initial primary PCI. You could see how difficult the procedure itself, and I never prayed that this patient would come back with a late stent thrombosis. I tried to wire into the side branch, and even a 1.5 or 2 millimeter balloon could not cross the proximal part of the circumflex to be dilating the side branch. Fortunately, the wiring of the side branch itself moved some of the thrombus at the mouth of the large side branch, and the flow started in the side branch. Hemodynamics stabilized. Patient continued on prasugrel and aspirin for 15 months because it didn't turn up at 12 months to stop that. And then subsequently, when it came up at 15 months, I switched over to clopidogrel and aspirin. That was in September 2013. And you could see that 8 weeks later, he came with a left stent, late stent thrombosis, and he was switched after switching to clopidogrel and aspirin. It was again an inferior wall STEMI with an intermittent complete heart block. Hemodynamically, he was reasonably good, perhaps because of ischemic precondition of the previous time. And keeping in mind the previous difficult stent as well as the device delivery during the initial PCI, I was keeping my fingers crossed whether I would be able to do it. You could see there was a significant thrombus in the stented circumflex column, occluding the total flow. There was a TIMI0 flow. Wiring itself was difficult. You could see the buckling of the wire, and finally I could succeed the wiring, and even thrombus suction catheter multiple times with the different types of thrombustor as well as diversey could not cross. I could not do a thrombus suction. Even 2.5 or 2 millimeter end balloon could not cross, and you could see there is no movement of the balloon into the proximal part of the stent. So repositioning of the guide wire into the OM did improve the flow into the side branch, but did not allow the balloon to be delivered or neither the thrombus suction to be delivered. So I was left with this circumflex being totally occluded. Can we play the next one? Yeah. So there is TIMI3 flow with no delivery of the devices. So the guide wire was finally removed. Grade 0 TIMI3 flow. Patient has chest pain, intermittent complete heart block. So what are the options before with no delivery of the devices possible? Well, I just thought about the intracoronary thrombolysis, even though it's not mentioned as one of the treatment strategies. The first bolus was given directly into the, slowly into the proximal circumflex with a microcatheter. He had a bradycardia and a near cardiac arrest, which was revived with atropine. Second bolus was given in the left main after 30 minutes, and a check angiogram was done after the second bolus. When the devices fail, please rely on the drugs. Microcatheter directed intracoronary thrombolysis was attempted, even though it is not a standard practice. And then I did bring the patient back after 24 hours. I could see that there was TIMI3 flow with no residual thrombus. There is no, it's actually the bend of the proximal circumflex which was preventing the delivery of the devices. There was TIMI-3 flow, no residual thrombosis anywhere, and patient remained symptom-free thereafter. He was maintained on ticagrelor as well as aspirin. So in difficult initial PCI, challenging second PCI with late-stent thrombosis, the PCI failed to deliver devices to remove the thrombus. Drug therapy helps save the life of the patient. So let's not forget that use the drug optimally when devices fail to restore the coronary flow. What is important is the restoration of the coronary perfusion, whether it's by the device or through the drugs. Do not give up if the PCI fails. Fall back on the drugs. Rely on the fibrin-specific thrombolytics, even in late-stent thrombosis, as illustrated in this case. Thank you so much.